deny that these are individuals who own or have access to firearms. Our members are not immune to the loss and heartache of losing a loved one to violence of any nature, including suicide. Going off script, I will share with you that I've lost two people to suicide since I've lived in the state of Connecticut. One was due to a firearm and one was a hanging. So we are not immune to this. We are very much as involved in this as anybody else is in any other cross section of our state. However, I would like to point out that Connecticut's 2020 suicide rate is one of the lowest in the nation per the CDC. Our rates are lower than 44 other states, including California, Illinois, Colorado, and Virginia. I would encourage you to explore an approach taken by the legislature of the state of Washington, which established the Safer Homes Coalition. The Safer Homes Coalition is comprised of firearms retailers, healthcare providers, suicide prevention experts, as well as Second Amendment rights groups. Members further include law enforcement and veteran services. This cohesive approach reassures a balanced effort that truly focuses on the outcome of suicide prevention. And I'd like to quote Safer Homes co-chair Alan Gottlieb's 2016 press release, in which he wrote, "Suicide prevention is not and should never be about gun control, but about saving lives and preventing tragedies. People working together have a far greater chance of accomplishing something than working against one another." The Connecticut Citizens Defense League asks this committee to vote no on HB 5397 and SB 477. HB 5397 will create an unbalanced advisory council, which is disconnected from the very people who own and have access to firearms, no doubt leading to distrust and inefficacy. As the state of Washington realized, gun owners cannot be dismissed from the discussion on gun safety and suicide prevention. Gun owners must be adequately consulted and represented if there is going to be a genuine discussion on reducing deaths in our state, which was not the case in proposed bill HB 5397. Thank you very much for the opportunity to testify, and I'll take any questions you may have.
I don't see any hands, so we will move to the next speaker, and that is Cathy Flaherty.
Good evening, Senator Kushner and members of the Public Health Committee. It has been a long day. My name is Cathy Flaherty. I am the Executive Director of Connecticut Legal Rights Project, and we represent folks in Demas, which means the folks in CVH and Whiting are my clients, and I have been waiting 5 years for this hearing. So I really hope that people will give me questions because I'm going to take every last second of my 3 minutes. I want to start by saying that families and victims have the right to voice their concerns and express their grief and their loss. However, that should not give them license to spout hatred, bigotry, stereotypes, and prejudice, or to say things that are false or misleading. I want to thank the committee for the bill. I recognize that it represents what you collectively believe can be accomplished in a short session, and is absolutely imperative that a bill focused on these issues gets through. You have my written testimony, so I'm going to spend my time responding to what I've heard other people say all day, because I have been with you since 9 o'clock this morning. Thank you for finally raising up the name of William Shahadi, whose abuse was the reason the task force got established in the first place, and recognizing the fierce advocacy of his brother Al. But none of us should forget Ben Rosado, the staff member at Whiting, who was a whistleblower, who died by suicide. If it was not for him going to the media, we never would have known about what happened. So we cannot forget him. The board approves 94% of applications. My question always is, what do they add to the process? Either Demas needs to bring more applications to them, or as the executive director of the board said, we need to allow Equities or their counsel to bring requests for temporary leave. I want to remind everybody here that the Treatment Advocacy Center is an organization that believes in forced psychiatric treatment. They give Connecticut good grades when force is used, like under the PSRB, but they fail us when we don't. For example, we don't have involuntary outpatient commitment. So I would recommend that you not make policy based on what grade they give the state of Connecticut. Too many people from both the PSRB and the Division of Criminal Justice think that medications are the only solution, that people have to stay on them for their entire life, that going off them leads to rapid decompensation, and that decompensation leads to violence. That's layer upon layer upon layer of assumptions that are not necessarily true. It's been suggested to you by me and others for years that if you really want to get solutions to problems, you should look to the people who are most impacted by the policies. And that's why I'm so appreciative of the efforts that this committee and DEMIS has made to make sure that people who are currently living at CVH and Whiting are getting to testify. And I appreciate the efforts everybody made. Question for all of you. Why is the PSRB important and effective? If it's that they ensure provision of services, why can't we just make sure that DEMIS does its job and has the resources it needs to provide those services? What the PSRB really does is provide political cover. They are political appointees appointed by the governor with a mandate for protection of society. So they make incredibly risk-averse decisions.
Excuse me, Ms. Flaherty, your time is almost up. If you please summarize. Thank you.
Yeah, I will summarize. I appreciate all the families of victims who testified that they even recognize that the system needs to change. But what I want people to know is the reason some of things aren't in the bill is because you aren't changing any of those things. You're not changing the victim notification. If you're not changing something, it's not going to be in your bill. The last thing I want to say is the PSRB is never the first people to make the decision. They are the last deciders. The treatment team has to make a decision. It goes to the forensic review committee. There's a consulting forensic psychiatrist involved, and only then do you get to the PSRB. That is why some of us have argued and believe in abolition, because in terms of the hospital process, they don't add much to it. There may be a role for community supervision. Again, thank you for listening to the people at CVH in Whiting. I encourage you to read my written testimony, including the live links in that testimony. I'm happy to answer any questions. Thank you.
Thank you, Cathy. Let me just, before I call on other members of the committee, let me just let you know that when you turn your head to look at your paper, we lost a little of what you were saying. We could hear it, but it's better when you're right close to the microphone.
Straight on.
Thank you. And I think, and I've known Cathy for years, so I felt like I could tell you that. I also want to say that as soon as you said you've been waiting 5 years to have this opportunity to address it, I saw Senator Anwar's hand go up. I know he was going to ask you something to give you, to acknowledge your 5 years of work in this area and to make sure that you have the opportunity to share with us tonight your views. So I will call now on Senator Anwar.
Thank you, Madam Chair. Thank you, Cathy, for your testimony, and thank you for your advocacy and commitment for the people and being the voice of the voiceless. You've said earlier about some data gathering that you felt was necessary. So you've not touched on that topic. That's something I think you had spoken to us before for the Whiting related conversation. And the second thing was you've simplified the PSRBs a little bit too much for me to feel comfortable. And I'm sensing there is value because the people sitting on that PSRB include forensic psychologists and psychiatrists with backgrounds rather than just political appointees. Can you?
Yeah, I'll address the first question first. In terms of talking about collecting data on race, ethnicity, and language data, if you look at DEMIS's own data, it really does show that the PSRB has a disparate impact. The number of Black men who are trapped in that system is very different from the number of Black men who are served in any other part of DEMIS. People literally spend decades at CVH, at Whiting and Dutcher, decades. The average length of stay in CVH, the civil hospital, is 3-something years. The exact numbers are in my testimony. The only reason the average stay in Whiting is shorter is because the competency patients don't stay there that long. Because if they're restored to competency, they get out, they go back to court, their criminal case goes through. But you heard from Anthony Dias earlier tonight, who was sentenced to a term not to exceed 25 years under the PSRB, and he's been inside for 43, I think. And there's just something profoundly wrong. I think Senator Summers at some point today, most defense lawyers know that you do not advise your clients to plead NGRI because you're probably this close to legal malpractice or ineffective assistance of counsel. Because once you know how this system works, you know that your client is going to spend far more time locked up in Whiting than they would if they pled guilty or found guilty. Because that's, I think, something we need to remember too. These are people who are found not criminally responsible by reason of mental disease or defect and are sent to the hospital for treatment, and yet we treat them like criminals. I know that several of you received copies of the letter that Connecticut Legal Rights Project and Disability Rights Connecticut sent to the Attorney General, to Demas, and to the chair of the PSRB. I'm pleased to report that we've already had a meeting with the Attorney General, and we plan to have another one after he has one of the AAGs has the chance to talk to their clients. And I'm hoping that we figure out how to go forward. This bill is an awesome first step, but we, DRCT and CLRP believe that it's insufficient to comply with the requirements of the ADA. Try to remember, in terms of the political appointees, I don't disagree that the people who are appointed to serve on the board have different backgrounds, but one of the backgrounds is like a business person from the community, unless that's the Whiting Advisory, soon to be Oversight Board. I just honestly don't remember. I've been listening very long all day. But the ultimate thing is that regardless of what their experience is, they serve on the board at the pleasure of the governor. And that means they can be removed from the board, I assume, if the governor doesn't like what they're doing or how they're making their decisions. I think, and this is just my personal opinion, but I think Demas likes having them there because say something does happen, because the psychiatrists admit they are no better than 50-50 at predicting violence. And so if everybody makes what ends up being the wrong decision and something happens because everybody makes their policy decisions on outlier cases, they're going to be looking to point the finger at somebody. And I think Demas likes having this other group to be able to point the finger at, because they can say, oh, we didn't make the ultimate call, the PSRB did. That's what I mean by political.
I see. Thank you. Thank you so much for your testimony. Thank you, Madam Chair.
Thank you. And I will call on Representative Carpino has her hand up.
Thank you, Senator Kushner. Cathy, I know it's been a long 5 years. I can tell you exactly where I was standing, what I was doing when we brought this bill out on the floor of the House, let alone everything that you helped us with to get to that point. And I don't think anybody on this committee has any doubts that we need to do a much better job. It's been a long-term time coming, and this is just a first step. But I have a tough question for you. There are individuals there who have committed horrific crimes. How do we balance that? You heard from one victim recently. You've heard from other victims over the years. And how do we balance the needs of both populations that are both very valid? I'd love your insight as we're facing this bill very shortly this week.
I really appreciate the question, Representative Carpino, and that's why I really started with, acknowledging that the victims have every right to come to you, to come to the board as it's currently constituted, and state their case. But here is what I would ask you to think about. When somebody's convicted of a crime, which means they've been found guilty of the crime, and sentenced to corrections, that person knows that's my sentence. And it's possible that I won't even serve that whole sentence because maybe I can earn good time credits. Maybe I can do other things. Maybe there's another way to get out. But if you are, if you're found guilty of something today, sentenced to 25 years, 25 years from now, you're walking out the door because that's all they can hold you for. But the way we currently have the PSRB is this is for people who are found not guilty by reason of mental disease or defect, sent to the hospital for treatment with the goal that treatment will make them better and they can return to society. They get sentenced for or sent to the jurisdiction of the board for really no longer than their maximum term that they could be convicted for. And yet we allow the board to recommit them. Something we suggested several years ago is if somebody meets their maximum term, you don't let the PSRB continue to hold them. You bring them to probate court and you civilly commit them. And if they meet the legal standard that they're a danger to themselves or others, or they're gravely disabled, then you will meet that legal standard and you will be able to continue to hold them. But you don't hold them under this like weird PSRB system that we currently have that's got this basis of primary concern protection of society. The other thing is, and this is where I get really torn on the victim impact statements at PSRB hearings. Those are supposed to focus on the person's present mental state, which is where are they at now? When victims come in, and like I said, I hear that, but that's bringing you back to the day of the incident, the index crime that they were found not guilty of. So it just keeps bringing it back and reminding people this is what they were like then. And that's where I have a really hard time. It should be a different system. It's not the criminal system. They were found not guilty. So I don't know how you balance that. I don't know how you work that out, but that's what I just asked. That's why you guys are legislators and I'm an advocate. You'll have to figure that out. And I can just bring you my concerns.
No, and I appreciate your honesty and your candor. And I do believe we do need to change the PSRB, but I don't think getting rid of it with nothing in place is a place I'm comfortable being at now. So I appreciate you recognizing that we do need something else. Although I do struggle, I would never tell a victim how they should present their testimony. That is their trauma. And I believe, and I respectfully disagree with you, that is their trauma to share. That is their story to share. And I would never tell them what they should present. I really appreciate your guidance and your help throughout this entire process. Sorry, Senator Kushner, you're at the bottom of my screen. Thank you very much for your time.
Thank you. And Cathy, I want to make sure I heard what you said, because I think the distinction you were making is about how should the person be evaluated at the moment, not with regard to when a victim tells his or her story. And I think
yeah, I think that's where I'm going with that. And I agree, Rep. Carpino. I would never tell somebody I am all about people sharing their stories and people who are able to take tremendously negative experiences and use that to forge advocacy. Just so you all know, for those of you who don't, I don't come to this solely from a professional perspective. I'm somebody who spent time in psychiatric hospitals as a patient, not always by choice. So there's a reason I do this work. But I think the same way that we've been discussing criminal legal system reform for the last several years. This is a subpopulation of people that have really been left behind in that discussion. And I think the key thing is that when the person is put under the jurisdiction of the board, sent to Demas for treatment, the focus should be on that person's present mental status. So yes, do I think victims should be maybe come in? But if the probate court is looking at whether the person currently meets the legal standard for civil commitment, I'm not sure a victim statement is relevant to that legal assessment, because that's talking about something that happened not presently. But, you know, for certain people, like we've heard really horrific stories today, the fact that the person might know where they live, that may bring in a level of present concern about where the person's at. So like I said, I think there needs to be more balancing and more recognition that people don't lose their civil rights under the ADA, even after they've committed a crime that they've been found not guilty of.
Thank you, Cathy. I appreciate your comments here tonight, your testimony. I don't see any other hands, so thank you so much for being with us all day.
Thanks.
Now I am going to, sorry about that, I muted in the middle of my sentence a little prematurely, but I am going to turn over the chair to Representative Gilchrist.
Thank you, Senator. Next, we'll hear from 129, Thomas Burr.
Yes, good evening, Representative Gilchrist and members of the Public Health Committee. I appreciate you taking the time tonight to hear my testimony, and I also have been with you since 9 o'clock this morning. My name is Thomas Burr, and I am the Community and Affiliate Relations Manager of the Connecticut chapter of the National Alliance on Mental Illness, otherwise known as NAMI Connecticut. I am testifying today in support of SB 450, an act concerning Connecticut Valley and Whiting Forensic Hospitals. The bill's stated purpose is to make various revisions to the statutes governing CVH and Whiting Forensic Hospitals. You have already had a discussion during your forum this morning on the actual recommendations of the Whiting Task Force, and we agree that while this bill does not represent all the changes that we would like to see, it is indeed a good start. You have our written testimony as well as the dozens of emails our members have sent to the committee leadership. Therefore, I'd like to focus on the items which we feel should also be included, specifically changing the PSRB task force recommended in the bill to a work group and require that the PSRB work group examine the abolition of the PSRB and recommend alternatives. At NAMI, we believe in the concept of nothing about us without us. Therefore, the legislature should include in this work group at least 3 people with lived experience as patients or former patients at Whiting Forensic Hospital. The insight and experience of people who have had lived experience inside this facility will be key in making sure that any changes will be positive and therapeutic and not just repeating the historic mistakes of this and other mental health institutional settings. I also want to echo Nancy Allisberg's earlier concerns, especially funding for community-based mental health services. Therefore, with these amendments, we support the passage of SB 450. I would also like to take a moment to reiterate the comments of Representative DeGraw in that the research has been done, and it is quite clear. People with mental health conditions are far more likely to be victims of violence than perpetrators of violence. And we absolutely reject the stigmatization of people with mental health conditions. And finally, we wholeheartedly second everything that Cathy Flaherty, the executive director from CLRP, just testified to. Thank you for your time and attention, and I will happily answer any questions you may have.
Thank you, Mr. Burr. I don't see any hands raised. Thank you for your testimony and your time tonight
My pleasure.
and being here all day. Next, we have 130, Dr. Stephanie Palmino.
Hi, I'm Dr. Stephanie Palmino. I'd like to thank the co-chairs, the co-vice chairs, and the honorable members of this committee. And thank you so much for listening to all of us. I'm here in support of HB 5397. And I'd like to just say that I'm a doctorate prepared nurse. I'm a healthcare clinician for 53 years. I'm board certified in public health, and I've been working in this field since 2002 in public health. I'm also a board certified case manager. I sit on a lot of boards and councils and committees, but today I'm speaking solely for myself. But I think it's important to let you know what some of my background is. I'm the immediate past president of the Connecticut Nursing Association. I'm chairman of the board of the Patient Is You Foundation, which is about compassion and treating people as you would want to be treated yourself, or as you'd want your families to be treated. And I'm rising before you today to urge you to support and pass HB 5397. As our daily news reports and demonstrates, there's no community in Connecticut that is immune to gun violence. It's at crisis levels in Connecticut and elsewhere across this country. We see it in television, we see it in the news, we hear it on the radio, and unfortunately, so many of our children and adults see it right in their own neighborhoods and homes. In 2021, as has been said before, gun homicides in Connecticut were at their highest level in 25 years, nearly double what they were in 2018. We're not just moving in the wrong direction, we're racing in the wrong direction, and I urge you, plead with you to please take some action. Not that you haven't, but some additional action. My professional credentials, like many of the people who have spoken before me, are extensive. I'm doctorate prepared. Only 1% of nurses have a clinical doctorate. I've done extensive work in public health. I've been in med-surg and emergency room, a big block in psychiatric care, clinically, administratively, and regionally. And I've seen gun violence from a very personal perspective. And I think that's what's bringing me before you today. I have a special interest in gun violence because I was a childhood victim in the form of secondary trauma when I was a first grade student. My father was shot in our home when I was just about 6 years old. And despite this having occurred decades ago, when shootings were not multiple times a day, this occurrence has had a profound and lasting impact on me, and it shaped my life. I'm going to be 75 years old in November, and I can still visualize the handprints of blood all over the wall where my father held on trying to close the door to his children's bedroom. I can still feel and see the bullet holes in the window and the wall into which I would stick my fingers. I was fascinated by the bullet wound scars, 2 in and 2 out. And I remember the reporters and photographers who swarmed our home. Hemingway stated in A Farewell to Arms that the world breaks everyone, and afterwards many are strong in broken places, but those that it does not break, it kills. I was one of those fortunate ones. I became strong in the broken places. Far too many children and young adults today face gun violence, not once in their lives, but day after day. We see them, some of them are broken, some of them stay broken. We don't all get to share the same benefits in life, even if we live in the same communities.
Excuse me, doctor, but your time is almost up. If you please summarize. Thank
Certainly.
you.
The social determinants of health give us a resilience that's not equal to everybody. And I'm kind of surprised that I haven't heard anybody today mention the concept of early childhood trauma and the havoc this can wreak on people throughout their lives. Gun violence leaves those who witness it feeling unsafe. It's loud, it's bloody, it's scary, it's frightening, but it doesn't just affect the people who see it. It affects all of them around us. And I'm hoping that through this committee, we can also look at all those things that cause this violence. Our children should not have to be able to tell us as elementary school kids how that they would handle an active shooter. Our kids shouldn't have to go to a party and worry about being killed. I'm urging you to please, please pass this piece in the hopes that it can give us some new action. We shouldn't have had to have 20 innocent 6 and 7-year-old babies in Sandy Hook and not have that spur effective action here in Connecticut. And it didn't. That there's something either morally wrong with us or our system if we don't change. And we did change, but we haven't changed effectively. I always have told my students and my staff, in public health, it doesn't matter what we do. It matters what happens because of what we do. And that's what I think this committee and this commission and this law could do. I thank you so much for your time.
Thank you, Dr. Palmino, and thank you for sharing your experience and the work you do to help others. We do have a hand raised. Senator Haskell, go right ahead.
Dr. Palmino, thank you so much for your testimony and for your patience this evening. I have to say that was some of the most compelling 3 minutes of testimony that I can remember, and we've had quite a few long hearings in this committee.
Thank you.
Thank you too for sharing your childhood trauma with all of us. I know that even years later, it can certainly be a challenge. I just wanted to give you an opportunity to talk about the community impacts of childhood trauma. I think that sometimes when we talk about healthcare costs imposed by gun violence, we think narrowly about those who are hospitalized or injured or killed themselves. We don't talk about the ramifications for their family, and it feels like you might be the exact right person to speak to that.
Well, I think, and I often say that I believe everybody is better than the worst thing they've done in their life. And I think that many people who have fallen into a criminal pattern or committed a crime, such as the ones we're talking about today, have very possibly had childhood trauma that made them what they are today. We don't look at that as a rule. We should be looking at that. All these people who are seeing murders and gang shootings and mass shootings and school shootings on TV, they're going to be impacted for the rest of their lives. We're looking at all kinds of trauma. And many speakers have said not just gun trauma, but gun trauma is a major issue in our country. It's a major issue right here in our state, even though we're better than many others. But it's going to have an impact on these children and how they think. Under the concept of early childhood trauma, it's believed that if a child has just one adult they can lean on, that they can turn to, that they can be saved from that trauma. I was one of those lucky ones because I had that. But I know so many people. I can look at my own family and see that not each person in my family turned out the same way. I happen to think I'm a nice person. I think that the best things in my life, the best parts of me, have come out of the worst conditions in my life. And that shooting was just a downfall of many, many childhood traumas. I mean, my childhood actually reads like something out of Oliver Twist, but I rose above it. And I was able to do that because the people around me and the organizations, including Catholic Charities, they reached out to we children and they provided what was needed and helped us feel whole again. Many children don't have that today, and that breaks my heart. As a nurse, as all nurses, what we're trained to do is to help people relate to the emotional reactions of health and lack of health and public health issues. Nursing deals with the emotional reactions to health, along with education and preparation. And I think that that's what this committee really needs to look at, not just the gun violence, not just taking guns away. I think this is such a wonderful opportunity to be bipartisan and to look at the social connections that could help people get back this dreadful trauma that we're living with here in our world. And I've heard so many people say gun trauma, it's not about the guns. Well, I differ. I think it is about the guns. I personally don't see why anybody would find joy in killing anything, let alone a person. But there are people for whom that's sport, and I'm not going to decry that. There was a period in my own life when I had a gun too, because I felt I needed it for protection. I think many gun owners, I think most gun owners are very responsible, but we have such a long way to go to get the hands out of the guns out of the hands of people who they should not be in.
Thank you so much, Doctor. I think you've given us a lot of inspiration for bipartisanship and collaboration, and I can't thank you enough for your testimony tonight.
Thank you, Senator Haskell.
Thank you, Senator Haskell. We do have another hand. Senator Moore, go right ahead.
Doctor, I want to thank you 1,000 times. I wish you were at the beginning and we could have prefaced our talk on that all the way through for the 150 or 60 people who signed up to talk, and many of them to talk about this. I did speak earlier about the trauma of even children witnessing the shootings in a park in Bridgeport that were going to play baseball. And I know that trauma lives with them. I've seen it in my own family, how it plays out, where one was exposed and the other wasn't.
Yeah.
And it plays out for generations. And that not only does it play out in the way of violence, it plays out in how they see themselves and other things that they're carrying. That you talk about getting to the root causes of something until you understand how that trauma impacts people who have witnessed it or people who have been the subject of it. You can never change anything because it lives with them. I have a nephew whose mother was sitting in front of where she lives and 28 years ago and was shot while she was pregnant, and the bullet is still in her. Do you think she's not carrying trauma and that trauma is not transferred to that baby? By the grace of God, that child has worked out to be fine and because of other influences, but that trauma lives with them. And that's that mental health piece that's so important with children.
And it's that sense of
From the
safety.
bill. Right.
People don't feel safe after that.
Right. But also I think they're acting, and listen, I don't have the degree in that you have, but I see it every single day as firsthand witness to see how it plays out. So I thank you for all your comments. I really did appreciate. I hope at some point that there'll be another opportunity to hear more of what you have to say about this.
Anytime at all.
Thank you. Thank you, Madam Chair.
I'm at your disposal, any of you.
Thank you.
Thank you, Senator Moore. Thank you, Doctor, for being here. And
My
for your
pleasure.
testimony. Have a great evening.
Thank you, you too.
Next, we'll hear from 132, Ricardo Pagan.
He's coming in. Thank you for your patience.
You're welcome. Thank you.
Go ahead.
How you doing, guys?
Hi, how are you?
I'm doing good. My name is Ricardo Pagan, and I've been in the system for 21 years. Altogether, 22 years I've been locked up. Like you can see, I'm not medicated. I can speak my mind off, and I know I only got 3 minutes, and it's sad that we get 3 minutes and we get cut off real fast. And the thing I would like to focus is on, yes, I feel bad for most of the victims that I heard tonight speaking about what happened to them. It's not easy, I understand that. And on top of everything, we're human beings too. A lot of us don't deserve to be locked up like animals and be crucified or prosecuted for other people's crimes. The board is crooked. The board do whatever they want, and the board is not the only one. Even the administration that run this place, even doctors that run this place. I know they want to say they don't want to get rid of the board. They want to oversight the board, and they need to oversight the doctors that work here too. Because most of these doctors, like Dr. Drasbad, she's my medical doctor in South One, Dr. Kale, Dr. Guzman, they like to medicate these clients over the limit. And I'm not here only to testify for myself and make y'all feel sorry for me. I feel sorry for most of the clients. They're behind this wall and they don't get a chance to have their life back. I came here when I was 24. I'm 46 years old right now. I don't take no medication like I said before. And I noticed the time that I've been waiting upstairs to have this moment here to speak up for the behalf of the patient. I saw most of the patient testifying too. And I know most of the patient, they're not even focused on the real topic of this meeting. They were focused on other things because they're so medicated, they can't even think for themselves or speak for themselves. And that's why I said these doctors, they working here with us, they need to be oversight how they're treating these patients, how they're medicating these patients. It's not a lot of treatment in here either. It's not. I don't have no illness. I have learning disability. I got problem reading. I know Summer. I spoke to Summer when I was down in Whiting when that Shahadi stuff happened. And I was praying to that to come to the light a long time ago because Shahadi wasn't the only one that got abused. I see what happened to Shahadi for many years. He been spit, he been smacked, he been getting black eye from the staff. And the staff they got arrested and fired, they needed to arrest more staff and cops. Even the cop, most of the cops, not all the cops, because some of the cops are good cops. And I heard the testimony of the cop earlier that she was speaking about a client that's down in Whitey right now that stabbed her. I feel bad for her too, and I'm really sad that happened to her. It happened to a lot of people, and we're not wicked, we're not animals, and that's the way they made us seem, and that's why this society don't want nothing to do with us down here. They want nothing to do with people in Whiting. I know some people don't deserve to have a chance because they're crying, and they deserve to have a chance to teach them things in life and have some kind of love and compassion for them. Because
I'm sorry, Mr. Pagan, your time is almost up.
I know that. I know that I'm not
Thank
going to ask
you.
no questions either. I'm hoping that the board to be demolished. And once the board to be demolished, the system, the administration, and the doctors that work here, the name that I mentioned before, to be oversight how they're treating these patients and medicating these patients, over medicating these patients. This is not a good system. And I'm glad for most of the people that did testify on our behalf. And like I said before, I'm gonna say it again, my name is Ricardo Pagan. I've been locked up ever since I was 24 down in Whiting. I'm 46 years old, and I want the best for the clients. It's not by me, it's by the patients here. And I know Gail Linsky testified earlier. She's my wife, we got married in here. And she's been through a lot herself. She's been abused by the staff. She's been bullied by the staff. She's been bullied by certain clients. And that she was forced to be assigned to a whole male unit because she can't be in South 3 because certain female that live in that unit. And no, it's not fair. We deserve a chance in life. And like I said before, and I'm gonna say it again, I feel real sorry for the victims. They've been through a lot themselves, and I will keep them in my prayers because I heard their pain and I heard they're afraid of most of this client being out and coming back after them. They don't need to be afraid, man. Trust in God. I trusted in God all these years, even through the things that I've seen happen to the patients down here, even the things that happened to me.
Thank you, Mr. Pagan. Thank you so much for your testimony tonight. And even though it was 3 minutes, it was very impactful. Thank you so much for your testimony.
You're welcome.
Next, we're going to hear from number 133, Christine Castles. Ms. Castles, are you with us? If not, we're going to go to 134, Jeremy Stein.
Good evening, everyone. Thank you, Representative Gilchrist and the distinguished members of the Public Health Committee. My name is Jeremy Stein, and I'm the Executive Director of Connecticut Against Gun Violence. And I'm testifying in support of SB 477 and HB 5397. On average, every day, someone in Connecticut is shot. Every other day, someone is killed by a firearm. Last year in Connecticut, there were 118 gun murders. Last week, along with Sean Reeves, we were having a community listening session in New Haven about gun violence in some of the communities most impacted by violence, in an effort to get at the root causes. One woman we spoke to lost both a child and a grandchild to gun violence and told us, our graveyards and morgues are being filled with children and young people faster than they can dig. We heard stories of family members murdered in the prime of their lives. A father said he is afraid to let his children play outside, even in broad daylight. Several students were there and expressed fear and hopelessness and felt that they had been forgotten. I feel like I'm screaming for help and nobody is listening, one person expressed. I probably won't live to see my 30th birthday. An older man said, I used to sit on my porch. Now I'm afraid of getting shot. We have heard hundreds of these types of stories, and we've heard some of them today in Bridgeport, New Haven, Hartford, Waterbury, and elsewhere. And some of the victims are even younger. Senator Moore had mentioned the story of 3-year-old Randall Jones Jr., who was murdered in a drive-by shooting while sitting in a car with his mother and 2 siblings. 2 hours later, less than a mile away, a 16-year-old was shot and killed in broad daylight. A year earlier, around the time that legislation was focusing on Ethan Song, 12-year-old Clinton Howell was murdered in front of his house. Clinton was an honor student and had a smile that could light up a room, according to his mother and brother. We are grateful for Senator Moore's leadership, who's been leading the charge from the creation of the Bridgeport Youth Gun Violence Task Force, as well as the establishment of the Advisory Council on Gun Violence Intervention and Prevention as part of last year's Senate Bill 1, and which declared racism a public health crisis. Now we must declare gun violence a public health crisis. But whether we're talking about SB 16, the governor's bill, SB 477, or HB 5397, it's encouraging that we're all talking about the same thing at its core: providing funding and support to communities suffering from the public health crisis of gun violence. We are not talking about suicide or mass shootings right now. We are talking about what is long overdue to address the pandemic of gun violence in our cities that claim the lives of mostly young Black males. I echo what has been said earlier. We are stronger together. But whether it's a commission similar to the California Calvet program or an Office of Violence Prevention like OVP established in places like New Orleans or Colorado, or a task force, Connecticut Against Gun Violence would like to see Senator Moore's bill, SB 477, move forward, incorporating language that is part of HB 5397 with the following key elements. Number one.
Excuse me, Mr. Stein, your time is almost up. If you please summarize.
Sure. Number one, declaring that gun violence in Connecticut is a public health crisis. Number two, creating a grant source to fund prevention, intervention, and aftercare strategies that include community-based violence interruption, hospital violence intervention, and group violence intervention strategies that work. Number three, establishing an ongoing advisory council with voices of those most impacted by community gun violence, young and old, to make sure that those voices that have long been ignored have the power to create real change. 4, establishing data gathering and research capacity to drive these community-centric, evidence-informed, and evidence-based solutions and to make them publicly available. To provide technical assistance to the funded organizations to help them access funding, but also establish metrics to show their success. And finally, to fund this at a minimum of $5 million per year in starting in fiscal year 2023, or sooner, for operating expenses and grant making, with most of the dedicated to grants and not overhead or salary. I think it is fitting that we were talking about this along with the Whiting patients, because this, like that, is about preserving human life and human dignity.
Thank you, Mr. Stein. We do have a hand raised. Chairman Steinberg, go right ahead.
Thank you, Madam Vice Chair. Jeremy, good to see you, though not so much at this hour.
You too.
Yeah, I appreciate your professed willingness to be somewhat flexible on exactly the shape of whatever legislation we're going to consider this year. And you're helping us focus on those, what you feel to be the key elements. I think we've heard that pretty consistently, though. I will say some of the testimony I've heard, I find troubling. And I've always been impressed by how CAGV has command of the data, knows the statistics that relate to gun violence. Perhaps you'd be able to help me. I don't know if you know these numbers or not, but how does, roughly at least, how does per capita gun ownership in the United States compare to the rest of the world, other countries?
We have more guns in the United States than it's close to, I think we have more guns in the United States than like close to the combined total of everywhere else in the world. And you know, what's been said over and over is, if guns really made you safer, then the United States would be the safest place on the planet. But it's not. It's a fallacy. Guns do not make you safer. And you know, and there's a lot of guns in Connecticut, not just legal guns, but illegal guns as well. And a lot of the crimes that we're talking about, a lot of the gun shootings that we're talking about in Connecticut that Senator Moore and others have been talking about, you know, it is we're really talking about illegal guns, but the reality is it's just too easy to get a gun right now, especially in these communities.
And would you know as well, how our gun fatalities and incidents per capita relate to other countries?
Yes, it is much higher, and even when we're looking state by state, those states that have the strongest gun laws tend to have the lowest gun death rate, and the converse is also true. So Connecticut, we are fortunate. I think there was a question earlier today, I think it was today, about whether or not things are working and things aren't. And it is true. Our laws do work because we have such strong gun laws. We have some of the lowest gun death rate in the country, fifth lowest gun death rate. But we need to do more. And I think while the legislature has been concentrating, NCAGB has been concentrating a lot in the past 30 years on the supply of guns and how to limit supply, this bill and these bills and this, and the idea behind these is we need to start focusing on the demand side. We need to start looking at root causes and why people, especially young people, are going to the gun to resolve their differences.
Well, thank you for that. Yeah. I'm guessing probably there are studies out there that might actually correlate the proliferation of gun ownership and the extremely high rate of gun deaths and gun accidents and the like. And that's what really stuck with me from earlier, is that several people who testified suggested that this violence wasn't really about guns. And that's the part I just don't get.
Yeah, there is a Hopkins study, I believe it's a John Hopkins study, that says that the more guns you have, the higher the gun death rate, the more shootings. I do think, I do agree with you, Representative Steinberg, but I think, when we're talking about root causes of gun violence, it's more than just the gun, right? It's about the access to the gun, but it's more than that. One of the things that I didn't really hear discussed much today, even though we heard a lot of things, is, something like reentry. Something like when people re-enter society after serving time in jail, like what is waiting for them? And if we don't provide some type of opportunity for people when they come back into society, then we failed them. And that's one of the other things, one of the many things, the multifaceted things that we need to be looking at when we're addressing gun violence, because it is complicated, and gun violence, especially in our cities, is more of a symptom of a bigger problem than it is the issue that we need to focus on. It's part of the problem that we need to look at, and it is a public health crisis, and it should be treated no different than any other pandemic.
Well, thank you for that. Yes, I really do think that's why we're talking about this legislation, is that we recognize that there are a number of root causes, systemic problems in society that lead people along a path where they are susceptible to the lure of what guns may provide them in terms of way of status and power, without necessarily an understanding that these were designed to be weapons and are likely to be used for that exact purpose. Thank you, Madam Chair.
Thank you, Mr. Chairman. And thank you, Mr. Stein, for your testimony and your time.
Thank you, Representative Gilchrist.
Next, we'll hear from 137, Sally Connolly.
Good evening to all the distinguished members of the Public Health Committee who have listened patiently and thoughtfully to testimony tonight and today. My name is Sally Connolly, and I'm a resident of Woodbridge. As co-chair of the Preventing Gun Violence Task Force at the Unitarian Society of New Haven, a member of Connects Do Not Stand Idly By, and a member of Connecticut Against Gun Violence, I strongly support HB 5397 as it affirms that gun violence in our communities constitutes a public health crisis, and that it will establish an Office of Gun Violence Prevention within DPH. In addition, I support elements of SB 477 and SB 16. I first became concerned with the issue of gun violence when my cousin committed suicide with one of her husband's weapons while he was serving overseas in the military. Since then, and over the years, I have seen, in fact, all of us have seen, the horrendous increase in mass shootings, domestic violence, murderous actions, and community gun violence that tears apart the fabric of our society, destroys families, and deeply hurts our communities. Each incidence of gun violence diminishes our towns and ourselves. We mourn the loss of lives. We deplore the violence. I know that some of you have visited the New Haven Botanical Garden of Healing dedicated to victims of gun violence. If you have not, I respectfully implore you to do so. Named bricks in a pathway usually honor contributors or founders. These bricks, however, with names inscribed of those killed, along with the dates and their ages, speak not of giving, but of taking. Lives lost, so much damage, such horror. I am grateful that Connecticut has been at the forefront of legislation seeking to reduce gun violence. But now we must put teeth in our actions. Robust intervention is not a given. We must ensure that there is a realization that this horrific violence is recognized as a public health crisis, and that we have a state-level office within the Department of Public Health with the capacity to make grants, establish policy, make recommendations, ensure evidence-based successful interventions, and collect and share relevant data. I look forward to your committee's positive recommendation of this community strengthening and life-saving legislation. Thank you. And again, I really want to thank everybody. Your questions of all the panelists have been so wonderful, and you have been so patient. Good night and have a good morning and a good day. Thank you.
Thank you, Ms. Connolly, and I'm sorry for the loss of your cousin. Thank you for testifying and your time tonight. Next, we have 139, Deborah Davis.
And good evening to Senator Moore, our champion in this effort and this endeavor to establish the gun violence advisory, to Representative Gilchrist. Thank you so much. This is certainly worth staying up for. I know I'm 139, but my name is Deborah Davis, and I represent mothers and families across the city of Hartford and the state, if you will, because we've been dispatched all over the state to help and to provide the support, the necessary support for those families who have lost children and loved ones directly. This for us is a crisis, and it is an emergency. This, we know that a lot of this gun violence stems from ecological deprivation. Individuals that sometimes are at the other end of the spectrum, not having access to some of the key resources that they need. And it really starts with our public health. Obviously, the mental health would be stemming from the lack of educational materials at the very beginning, the environmental, which includes the housing and the environment itself. And these are some of the root causes that I think people fail to look at, and they fail to see the inequities from the very beginning. And for us as mothers, when we do everything that we can to make sure our children are safe, we're looking at root causes. We're looking at how our children do have access to guns. Sometimes they're being brought into the community. Sometimes they're easily accessible because people do come through urban environments to do so many different things. And I don't have to tell you because they come from all over. We've been a part of many, many gun buybacks. Those guns are coming from all over our state, but for the most part, they're coming from the suburban communities. And so what we have to make certain is that our children have a fighting chance at the very beginning, from their lack of access to good educational resources, to public health, public health entities that would provide some of that that undiagnosed trauma that we talk about every day, undiagnosed trauma in our urban areas that there's less access to. And so I want to make sure that those mothers and that those families have access to every element that they need and every resource that they need in order to really compete at the level that they need to compete at. If a mother has 2 and 3 jobs, that mother wants to make sure that her child is safe at home in the very environment, and not having the child have to walk to school with yellow tape every day. This is an emergency, and this is an epidemic. We have to address it as if it is attacking every side of our living environment, both from that the public health and from the educational and from the environmental. That is very important. So this advisory committee.
Excuse me, Ms.
Council,
Davis, your time is
yes.
almost up. If you please summarize. Thank you.
Thank you, thank you. This advisory council is key because it'll give the grassroots organizations like Mothers United Against Violence has been around since 20 years and have been boots on the ground, going from home visits to hospital visits to working with the families in the trauma setting, all the way through the court setting. And so that court from one area of to the next area, there's trauma, consistently trauma. That's why it's really public health, because the trauma that has never been diagnosed. And what we're doing is we're creating revolving doors. And if you don't address it now, it can only get worse. And this is the part that we do for the entire state. So what we do on the intervention and the prevention side in the urban areas help to prevent and intervene for our outer areas as well. And I think everyone should see it as a way to help with the intervention, as a way to help with retaliation, to prevent retaliation, to prevent some of the sprawling things that are happening from the urban area. But it's key. Listen to the voices that you never probably see, but you hear. You hear those voices. You hear the grief of mothers of diversity, mothers of African-American descent, mothers of Hispanic descent. You hear those voices. You hear the mothers across the board, but we want to make sure that those voices are heard. And that is the key area that is so important, that we're helping to prevent, we're helping to intervene. That's important. And we thank you for the opportunity to talk about some of the root causes that this epidemic, gun violence, is so prominent and prevalent within our communities, not just in the state of Connecticut, but across the country. And if you have a way to help to make this entire epidemic, this entire emergency, the state of emergency, to begin to decrease in terms of having more access to different resources, having groups that are on boots on the ground. And we see the yellow tape, we see the blood, we see this. This is nothing that I have read about. This is something that we have actually seen. These are firsthand testimony. And I want you to understand how real this is. This is part of this everyday life of some of these families. And we have to make sure that we speak for them when they can't speak for themselves. Thank you so much.
Thank you so much. So there's a few hands raised, but before I get to those, I'm so glad you mentioned the boots on the ground and describe some of the work you do. Could you share with the committee the event that you hold annually, which I know because of COVID has been delayed, but just describe that event if you don't mind.
Okay, so there's several.
But the march.
March. Okay. So this year we will be doing a caravan. The caravan is typically a march and rally that have the families coming out, because we utilize the families to help on the prevention side too. I mean, we go back to see something, say something all the time. If they see something, they'll be able to communicate. They'll be able to communicate with us, or they'll communicate directly with the police department. That for us is prevention. That for us is intervention. And so what we do is we take all of the families around the city, both the south end and the north end of Hartford, moving with their photos and their memories of their loved ones on their vehicles, letting people see how all of these lives have been impacted. And we talk about how important it is to make certain that you preserve and you protect your family, because everyone understands protection. Everyone understands preservation. Everyone wants to have their family or their family member live the next day. Part of that caravan, because of COVID, takes us through the city with the police department, guiding us to all the spots. And even where Randall Jones was murdered, our 3-year-old, on Garden and Nelson, every hot spot throughout the city, to make sure that people know that these people care. And this is one thing that folks don't see. I'm always hearing, well, what are you guys doing? We want to make sure that you understand that we're being proactive. And in that proactive, we could prevent the loss of another life. And so part of that march, it was normally going to the Capitol to talk about how important it is for our legislators to see the families that live in the urban areas, to communicate directly with us. It's hard to get to some of you, but we know that if you can hear our voices, and if you can witness, and we invite you to come out for our caravan as well. It's on April 16th of this year. But this is our 13th year. And we would love to have some of the legislators out and travel with us. We have a police escort that takes us all around the city. Normally, we've marched from one part of the city down to the Capitol to really talk about and have guest speakers. We've always worked with all of the groups in Hartford, across the state. We've worked with Newtown, we've worked with CAGV, we worked with all the groups across the state, just demonstrating that we do have a voice. We worked with the Red Flags years ago. We were advocacy for that. So we've been on the ground and on the front line for a long time. And now it really is time for our state to step up, our legislators to step up and really help at the level of where that help is necessary. And those are resources that a lot of community organizations do need and do require in order to really move to the next level. But along with that, we also do a unresolved case forum. That helps us to work in the extension for community policing. So what we are telling our families is that we don't believe in defunding the police. We believe in helping to see how we can help to preserve our families, our communities. That's number one. And if there's anything that you can do to help with that, that's what we want to do. So we bring some resolve to cases that have not been closed, because that's another level of trauma. And when we talk about trauma, we talk about our kids walking to school with yellow tape. We talk about our moms and our dads, trying to get through the next level if they have to go to court. All of that is trauma. Hospital, all of that is trauma. The way they're treated at the house, everything is trauma. So these are situations where there's been undiagnosed trauma, which can lead to further trauma, which absolutely leads to major mental health issues. So these are the areas that we have really been focused on.
Well,
And
I want to thank you, because I've attended 2 of the events. You've just taught me so much, but it has a tremendous impact. And if the committee, I'll just share this, when you honor the victims of gun violence in Hartford, what will stick with me for the rest of my life is that you ring a bell for each year of deaths, and there's not enough people at the event to hold up the crosses. And so you lift a bin full of crosses that represent lost lives.
Yes.
And it is so painful but to be surrounded by individuals whose loved ones have been lost, it's just, if anyone is, people should attend. Then the other event you had where you brought us through Hartford.
Yes.
As your neighbor, as
Yes,
a West
your
Hartford
neighbor.
state representative.
That's right. That's right.
I drove 6 minutes to get
Yes,
to the
you did.
event, but
From
I
West
will
Hartford,
own, I
yes.
had never been to that part of Hartford.
Yes, exactly.
And it was very eye-opening.
Yes.
And once again, we'll never forget. And so I thank you for educating me. We do have some other hands raised, so let me go to Representative Zupkis.
Okay, beautiful.
Thank you, Madam Chair, and thank you, Mrs. Davis, for doing what you do. You're very passionate, and I believe you are making a difference. So thank you. I have one question for you, and I just wanted to be clear. You had mentioned when you did the gun buyback that it was guns coming from suburban areas.
Absolutely.
How we're talking about gun violence in this inner cities, how do we get the guns, the buybacks to work in the inner cities and get those guns back?
And so that's a great question. That is the area that we're working on right now. That is movement through the specific neighborhoods. That may be door to door communicating with families. But one of the reasons why we do communicate and keep our relationship and maintain the relationships with the moms is because they hear, they see things, and they want to protect their family.
Absolutely.
So one of our inroads is to help make sure that we maintain that communication. And even with her next child that may not be doing anything, but may become a victim, an innocent victim or bystander. This is the part that I think a lot of folks don't really understand, because there are not that many shooters out there. It's just that it appears because there's so many guns that they have access to. But some of these young people are just victims by a happenstance or circumstance. Right. And they're innocent. Some of these young people are innocent. We've had several that have just been in the wrong place where they're thinking they're in the community. I don't even like to say this. They should be in the right place because that's where they live. But they may have walked out at the wrong time. The police department just solved a case, 13, 14 years, young lady sitting on the porch with her baby, and she was shot. And 14 years later, just recently solved that case.
And that's horrible. It's horrible. And but the gun, buying back the gun from the suburbs doesn't solve that problem. It's how do we get those guns away from those people in the cities driving by and shooting? Right. And I can never imagine, and I hope none of us have to imagine that happening to our child. It's horrible.
It's horrific.
It is horrific. So thank you for working with those moms. And I hope that we can get those guns from the criminals. They're criminals.
Absolutely.
So absolutely. We need to get them from the gangs, and we need to get them from the criminals. And
absolutely.
I'm hopeful. I don't know that saying it's a public health crisis is going to solve that. It's more about really what we can do to get those guns out of criminals' hands.
Right. And I think if more states saw it as a public health crisis, because the public health part of it is the mental health, the all of the environmental pieces that go with that, living conditions, environmental, everything, the educational, the medical access, all of those things. And so we're also, communicating at every level. That's really, really important. But I do want to say something, because sometimes the guns are actually purchased from folks who are driving through the city, and they're selling their guns pretty dirt cheap. And so we have to factor that in, because some of these guns come from people that have just had so many guns and they want to release them, and sometimes that happens. And we've heard of those stories. But they pretty much they release them, and whatever it is that they get, that's the way that exchange goes. People come into the go on.
Yeah, I was just going to say, and then I'll let someone else. Have you, I'm sure you must have tried to do a gun buyback in the city.
We've done
And it
several.
hasn't, how was it successful? I mean, how many?
Yeah, well, we've had great success in Hartford, incredible success in Hartford for gun buybacks. But coming directly from the neighborhoods, we are working on that that strategic plan right now as we speak. We will be teaming up with the Songs and the Newtown folks to do a statewide gun buyback. And we've been doing gun buybacks for over, oh my gosh, now it's been over 14 years. We've been at every gun buyback that you can think of, and we'll talk about champion it, and we'll do everything that we have to help, because we know how important it is. But we will be strategically looking at a plan of action of how we can get right into the neighborhoods and help to secure some of the guns. Absolutely.
That's what has to be done. Because if we've been doing gun buybacks for years and it's getting worse in the cities, we're not getting to what needs to be gotten to.
Absolutely. You're
Thank
absolutely
you.
correct.
Thank you.
Thank you.
Thank you, Representative. And we have one more hand. Senator Kushner, go right ahead.
Thank you, Madam Chair. And Ms. Davis, I just wanted to say I've heard you speak before, and it always is very impactful. So, I'm glad you were able to be here, even though it's so late in the evening. I do want to suggest to you that I would be very interested in participating in one of your activities on the tour. And so I hope that when this gets arranged, that you'll make sure that all of the legislators, even though I come from the other side of the state, from Danbury, I think it's something important for all of us to participate in, so we fully understand the work that you're doing. And I really do appreciate your being here today and all the work that you do on behalf of all of us here in Connecticut.
Thank you so much. And I have to add that with our group, we have a group that is the Circle of Compassion, which really focuses on therapeutic mental health issues with our moms. So they are always looking for respite. They have therapeutic meetings with us. We call on a social worker to provide some of the support as well. A lot of us are trained in the pastoral counseling area. So we do have access to the grief counseling and the compassion. That's really core, because it helps to stabilize not just them, but their home. And one of the things that we know that these moms want to do, they want to survive. They want to be an added value, to their city. They want to make sure that they can become a viable entity again, even after the grief and the trauma. And not having access to major resources, they want to do that. If they want to maybe return to work, or if they want to return to school, maybe get further education, we help them do that, because we know how key that is. If we can help them stabilize themselves and stabilize their home, we can help them stabilize their other children. And so for us, that's the way we look at it. We know that the intervention prevention is really key, but we know also how important it is to help to create viable folks that add so many major contributions. And our moms are talented. I got to tell you, I just got to brag one second. They do crochet, they knit, they sew, and in the therapeutic circles, they create an environment for themselves that helps with the healing. And it's just an incredible, and I love to invite you out to one of those sessions once we sort of get back into the regular mode. But they've been doing so many things, and they've actually surprised us. So some of the things that we see, we know that it is helping, and they're calling us, are you going to have a session today? And so we're excited about that. The whole team, Reverend Brown, Mrs. Beckman, these are our co-founders from 20 years ago. So we've been out there from, that time frame, and it's not just work for us. It's passion, and it's the compassion. And we don't look at them as numbers. We look at them as human beings having so much value, because they have suffered and they have been through so much. And some of them are striving to the next level. And we're having to always communicate how important it is for them to continue to survive. So for us, it's about sustainability as well. So we do want to help to create a better environment. So if you ask me about economic development, we want to talk about that too, because that's part of the sustainability. That's part of, making sure that they do have, access to pretty good resources. That's really important. and living conditions. Thank you so much. I know I kind of rambled on a little bit, but thank you so much for listening.
It's great hearing from you tonight. Thank you. And thank you, Madam Chair.
Thank you, Senator. And thank you, Ms. Davis. Always wonderful to hear you and see you.
And the same here. Thank you.
Next, we will hear from 143, Claire Lee.
Good evening, Committee on Public Health and distinguished members. My name is Claire Lee, and I am currently a sophomore studying ecology and evolutionary biology and political science at the University of Connecticut. And I come here today as a citizen of the town of Glastonbury, Connecticut, to express my support for Senate Bill number 477. As a young woman, I want to first highlight and praise the addition of subdivisions 104 and 105 as outlined by the bill on establishing a maternal mental health month and day to raise awareness surrounding maternal mental health. All too often, the stigmatization of not only maternal mental health, but mental health overall is overlooked, especially during a global pandemic. We have witnessed the widespread exacerbation of mental health issues in children, adults, and seniors alike throughout the pandemic. SB number 477 will shed light on the struggles that mothers experience, including post-pandemic workplace discrimination as we transition from the remote to in-person work settings and the long-ranging repercussions of postpartum depression. However, this is just the first step towards destigmatization and tangible change. I implore our legislative body in the future to delve deeper into this issue and work alongside professionals across the state to develop other initiatives that serve to address maternal health. In a generation that has unfortunately grown to become desensitized to gun violence around us, I also want to bring attention to Section 7, establishing a commission on gun violence intervention and prevention to mitigate community gun violence in Connecticut in my support for this bill. I consider myself fortunate enough to have received a secondary education at my local public high school and to eventually pursue an undergraduate degree with a primary goal in mind, like many other students across the state, to obtain an education. I hope that our future generations, many of whom will walk our state's school grounds with the same goal, will not have to fear falling victim to gun violence in a place that is supposed to foster learning and growth. I hope that our future generations will thrive in an environment equipped with informative and community-centric gun violence mitigation programs that this bill will provide, rather than one where this issue continues to be overlooked and normalized. I am a resident of the state, and I value the committee's prioritization of a multifaceted issue. I stand here to advocate for any progress that our legislature strives to achieve in solving even the most deeply rooted statewide issues. I strongly believe that this bill will pave the way for change. I appreciate your time and consideration tonight. Thank you.
Thank you, Ms. Lee. Don't see any hands raised. Thank you for your testimony and your time tonight. Next, we will hear from number 144, Stefan Marzuk. Mr. Marzuk, you're not muted, but we can't hear you. Can't hear you now. No. I could read your lips, but. Do you want to log off and log on? Okay, great. So we'll go to the next person. Then when you log back on, we'll let you go. Number 146, Cynthia Hayes.
Good evening, everyone. Can you hear me okay?
Yes, go right ahead.
Okay, thank you. My video is off because I am an interdisciplinary doula and I'm actually working this evening and I want to respect the privacy of the family that I am with. I am in support of HB 5500 and I want to speak a little bit to the Section 40 regarding the advisory board for certification of doulas. It has become more apparent that negative birth outcomes are affecting the lives of birthing persons, their children, and families. Connecticut has not been exempted. We're almost there, but not quite. It has been proven in research that having a doula during labor can mitigate negative outcomes like reducing the use of Pitocin, reducing the need for pain medication, increasing the initiation of breastfeeding, just to name a few of the benefits. Doulas are also engaged with families during the prenatal and postpartum periods. They provide support and information to birthing parents and their families during every phase of their pregnancy and postpartum. I think it is essential that we continue to explore ways that we can provide access to doula services. Doulas are now recognized as a profession, and there is a definite need to explore ways that this profession can expand so that others can gain knowledge and access to doula care. Having an advisory board will encourage intentional discussions, and effective planning. There has been collaboration from local and national organizations in support of engaging the community because it is necessary. There are negative, long-lasting effects of negative birth outcomes that can include the death of the birthing parent and child that need to be eliminated. Unfortunately, Connecticut is still outpacing the national average for some of these negative aspects, like an increase in C-sections, and we need to take responsibility. We have the willingness, but now we have to use all of our resources, talents, and techniques to assist Connecticut constituents. What is more sacred and important than creating a safe environment so we can have healthy families? And finally, an advisory board regarding the certification of doulas will allow there to be more robust and relevant conversations regarding the qualifications and recommendations. There is a concern about compromising the integrity of the profession and locking out other qualified doulas that don't fit the traditional model for a doula. These are valid concerns among those in the Connecticut communities that continue to be disenfranchised, undervalued, under-resourced in our society. Please pass the bill as outlined. Thank you.
Thank you, Ms. Hayes. We do have a hand raised. Senator Moore, go right ahead.
Hi, Cynthia.
Hello, Senator Moore.
I'm so happy we got to this place. You know, we had this bill a while ago and it didn't get called. It passed the Senate, but didn't get called in the House. I'm so glad we're here because it gave us some time to work on the bill. I hope it fits the needs, and I hope it's a place that we can continue to grow and include
Absolutely.
more. But I want to thank you for allowing me to be a part of this early on and educating me and being a part of this journey to see something that could make such a difference in the communities of color to improve birth for Black and Brown women. So thank you. I appreciate you, Julie.
Oh, I appreciate you, Senator Moore, and how you initiated this years ago. And like I said, we still have a ways to go, but I definitely believe that Connecticut is headed in the right direction. And I'm very proud of the conversations that I've been having with DPH and DSS, and we look forward to great things.
Good. I thank you. I consider this to be legacy work that when you can impact so many new generations of people who are doing this work and enlighten so many people on the importance of it. So thank you. Thank you, Madam Chair.
Absolutely.
Thank you, Senator. Thank you, Ms. Hayes. Have a wonderful
Thank
evening.
you. You too.
Next, we'll hear from 147, Kevin Borup.
Well, hello, Senator Abrams, Representative Steinberg, Representative Gilchrist, and other esteemed members of the Public Health Committee. Thank you for the opportunity to testify in support of both House Bill 5397 and Senate Bill 477. My name is Dr. Kevin Borup, and I'm the Executive Director of the Injury Prevention Center at Connecticut Children's Medical Center, and I'm an Assistant Professor in Pediatrics at the UConn School of Medicine. I'm testifying in support of HB 5397 and SB 477 because we need the focus on community violence prevention and intervention that these bills create. At Connecticut Children's, we know that only about 10% of children's overall health and well-being is determined by the healthcare services they receive. Furthermore, 80 to 90% of our desired outcomes for kids are driven by social, environmental, and behavioral factors. We work to improve the social determinants of health, such as housing, transportation, food and nutrition, and family support services through our Office for Community Child Health. We know that strong families, healthy homes, and healthy communities build healthy kids. The coronavirus pandemic has unfortunately only served to exacerbate many of the existing social and economic challenges facing families. And we believe that the work we do is now more important than ever, and supporting and strengthening community violence prevention services is part of that critical work. Now, in my written testimony, I have a whole paragraph with facts and figures that you've heard over the last, I think it was 13 hours or 12 hours, so, or whatever it is. So I'll move on from those. We know that an ever greater number of children are left injured or suffering mental and emotional trauma from witnessing violence acts, and the burden is disproportionately borne by marginalized communities that face continuing disinvestment, discrimination. It's long past time that our children and families in the state are served by thoughtful and dedicated leadership and funding and long-term planning on the issue of community violence and gun violence that these two bills contemplate. When people are hurt badly in our communities, they end up at Connecticut Children's or another level 1 trauma center like Hartford Hospital or St. Francis. Our job is to save their life with a medical intervention, but we can't simply do this. We have to do more. And that's why we are engaged in efforts here in the city to develop hospital-based and stronger and more vigorous hospital-based violence intervention programs by working with St. Francis Trinity Health, Hartford Hospital, Hartford Communities That Care, Compass Youth Collaborative, and of course, Deborah Davis and Mothers United Against Violence. And I was so happy that I could actually hear Deborah tonight, who I'm always inspired by her words. Hospital-based violence intervention programs and other critical resources and services would be supported by the creation of this kind of independent body to serve to develop these effective violence prevention and intervention approaches. And
excuse me, Mr. Bora, but your time is almost up. If you please.
I will wrap up. The research part of this is important, and many programs are popular. And the DARE program earlier today was cited as an example. But those who do research, we know in the literature that it is an ineffective program. It will be important with these two bills to link it to academic research like the Yukon Arms Center to ensure that there is evaluation of any of the investments that the state makes in violence prevention efforts so that we know what we're doing works. Thank you very much for listening to my testimony tonight. I appreciate having that opportunity. Thank you.
Thank you, Dr. Borup. It's good to see you, and thank you for the work you do in Connecticut. I do see a hand. Dr. Pettit, go right ahead.
Thank you, Madam Chair. Thank you, Dr. Borup, for staying up late with us. The injury prevention facility at Children's, you see a lot of different violence. A number of speakers tonight have talked about the issues of various forms of violence. In terms of impact on children, what would you say were the top 3 or 4 causes of violence in the lives of children that you interact with at CCMC?
Violence, what we'd see in our hospital are assaults, stabbings, and of course we do have firearm violence. We see a lot less than Hartford Hospital and St. Francis, and in Children's it's about 8 to 12 gunshots a year, but we see all sorts of other violence, including child maltreatment, of course.
Thank you. And the domestic violence issues, you see some of the fallout from the kids, but the adults obviously have seen it in Hartford, other facilities presumably.
Right.
Thank you for that perspective. Thank you, Madam Chair.
Thank you, Dr. Pettit. Thank you again, Dr. Borup. Have a wonderful evening. Get some rest.
All right. Thank you.
Next, we will hear from 148, Christopher Carter.
Hi, good evening. My name is Christopher Carter. I'm president of the Connecticut Assisted Living Association, and I'm pleased to be able to appear before you concerning Senate Bill 477. Kayla appreciates and takes to heart the Public Health Committee's concern regarding caring for vulnerable residents with Alzheimer's, dementia, and other similar conditions. However, we do have concerns regarding the bill as it's currently drafted. While Kayla would support some of the disclosures put forth in the proposed legislation, we have serious concerns that, for instance, it requires a different, more intensive level of care than is allowed in the managed residential community setting. The bill appears to overlay on MRCs many of the staffing and regulatory requirements imposed upon nursing homes, which provide a higher level of skilled nursing and serve patients with greater acuity. Additionally, our members are still grappling with workforce issues brought on by this pandemic, and it is crucial that they have flexibility to staff according to the unique needs of each community. Under the MRC model, it's important to note our residents must be chronic and stable to live in our communities because MRCs are not licensed to provide nursing home level skilled care. Our residents live independently in residential communities with apartment style accommodations. They can opt for support services, assistance with activities of daily living through what are known as ALSAs, or assisted living service agencies. In contrast, nursing homes are clinical settings where residents require skilled nursing care. It's also important to note that DPH is responsible for licensing ALSAs and provides appropriate regulatory oversight if sufficient staffing is not being provided. Furthermore, dementia care special care units are currently required by statute to disclose staffing ratios and to update the disclosures if there are changes. Very importantly, a resident's needs are assessed by the ALSA upon admission and every 120 days or upon a change in condition. And the ALSA is required by state regulation to determine the appropriate staffing accordingly. Implementing a staffing ratio would be unduly prescriptive and would compromise the independence afforded to assisted living residents who do not require a uniform level of direct care. For all these reasons, Kayla respectfully opposes the bill as currently drafted and urges the committee's rejection of pending further discussion and input with industry stakeholders. We stand ready to work with you to ensure our seniors are cared for in the safest, healthiest, most appropriate manner possible. There's no higher calling. And I would just like to state that Kayla shares your interest in finding common ground around short-term solutions in the interest of all older adults and families, perhaps surrounding improved communication and training in memory care in particular. Kayla remains available to serve as a resource to committee members as these and other assisted living proposals evolve. Thank you very much for your consideration.
Thank you, Mr. Carter. I don't
Thank
see
you.
any hands raised. Thank you for your testimony and your time.
Thank you very much. Good evening.
Next, we have 149, Johanna Schubert. You're on mute.
Thank you. Thank you, Representative Gilchrist. Good evening, everybody. Good evening, distinguished members of the Public Health Committee. Thank you for the opportunity to testify on behalf of SB 477, specifically the language in Section 7, establishing a commission on gun violence intervention and prevention, and also HB 5397. My name is Johanna Schubert, and I work at Hartford Communities That Care, a nonprofit located in the north end of Hartford. You heard earlier from our executive director, Andrew Woods. Our agency works directly with gunshot victims and their families using the evidence-based best practices model hospital violence intervention, or HVIP. You've also heard about HVIP earlier this evening from many of our distinguished colleagues and community partners. This model engages with victims and their families right after an injury, often at bedside in the hospital, where research has shown we have a golden moment to build a relationship and change outcomes. Our team of frontline violence prevention professionals, alongside case managers and other staff, work holistically with families. We connect families with trauma-informed and culturally aware mental health services, in-home nursing and doctor visits, support through any justice involvement, and in worst case scenarios, we help families and support them through funeral planning and other family support after loss of life. HCTC, along with its hospital partner, St. Francis, have provided this opportunity of support to over 1,800 victims since its partnership began in 2004. The HCTC and St. Francis partnership was the first HVIP to be recognized in the state of Connecticut by the Health Alliance for Violence Intervention, or the HAVI. In addition to my work with HCTC, I also serve on the board of Connecticut Against Gun Violence as the chair of the Urban Gun Violence Committee. Under SB 1 last year, with the guidance and leadership of Senator Moore, the Gun Violence Intervention and Prevention Advisory Committee was established. Composed of frontline, hospital, and other stakeholder professionals, they were charged with making recommendations on ways to bring down rates of gun violence. In the final report, which ran over 400 pages, the very first recommendation was to establish a standing commission to address gun violence intervention and prevention. If passed, SB 477 will do just that, putting into practice the strategies and interventions known to be best practices. Our frontline community agencies know how to address gun violence. They know the families affected, they know the toll the work takes on the employees, and they know that success means lives saved and a better quality of life for all those involved. What those frontline agencies don't know is if they will have the resources to do the work day to day. Establishing this commission will provide stability of funding that's crucial for the continuity of care that these frontline agencies provide in the service of saving lives.
Thank you, Ms. Schubert. Thank you for all the work you do and for staying up late. I do see a hand raised. Senator Moore, go right ahead.
Thank you. I just want to say good morning. It's morning now, but thank you. I do appreciate you staying up to give that testimony, and you summarized the results of the advisory and the work that they did, which is really important. You don't put together a group of people and have them come together, make recommendations, and then ignore the recommendations, because we consider those people to be the experts. But we're going to try as hard as we can to incorporate both ideas from the governor's bill and 5397 to make it a really strong bill that we can all live with and support and build on it from there. So thank you. I appreciate the work you're doing.
Thank you, Senator Moore.
Thank you, Madam Chair.
Thank you, Senator. Thank you, Ms. Schubert. Have a great evening or morning.
You too. Thank you.
Next, we're going to try again. 144, Stefan Marzuk.
Can you hear me now?
Yes, we can. Go right ahead.
Perfect. Thank you, Representative Gilchrist. Good evening, Representative Steinberg, Senator Anwar, Representative Pettit, Senators Huang and Somers, and distinguished members of the Public Health Committee. My name is Stefan Marchuk, and I'm a lifelong Connecticut resident of Cromwell and Durham and graduating senior at the University of Connecticut. I am testifying in support of Ray's House Bill number 5397 because I believe this legislation will help to drastically reduce not only gun violence in our state, but the factors that lead to the perpetuation of such violence as well. As a student, gun violence in the form of a mass shooting is unfortunately at the back of everyone's mind, given how prevalent they've been over the past 3 decades. My senior year at Coggins Regional High School was tarnished by 2 separate incidents involving threats against the school by troubled students seemingly idolizing the perpetrator of the Stoneman Douglas High School shooting in Parkland, Florida. The performative nature of mass shootings is one of many agonists that are often overlooked as factors contributing to the spread of gun violence. Its deleterious and widespread influence on mental health, exacerbated through social media, means the community-based gun violence this bill addresses may not always be isolated to the community from which it originates. This is just one of many factors that require urgent research and remediation. My hope is that the creation of the Office of Gun Violence Prevention and its advisory council will not only help to identify these factors, but bring about tangible change to how gun violence is treated. Creating an office that would house a repository of gun violence related data would aggregate its own research would be critical before implementing any sort of initiative. While equal care and intervention sounds promising, equitable care and intervention is more feasible and cost effective, and by targeting treatment to those who need it most, community spread of gun violence will decrease. I appreciate the language included using this sort of public health perspective in regards to the office's grant program, but urge the committee to include that the priority to areas with the highest occurrence of gun violence is determined per capita. While gun violence is more prevalent in larger urban cities, it does not mean that it is endemic to only them. Newtown, Connecticut and Parkland, Florida are only about 1/4 of the size of Connecticut's largest cities, yet these communities have been severely impacted by gun violence in the past. Mental illness in smaller communities can't be discounted as a factor secondary to others, as we have seen the devastation such carelessness has produced. Along the same lines, I recommend the committee include language to add a 7th category of membership to the Advisory Council on Gun Violence Prevention and Intervention, this category being a mental health and/or adolescent mental health expert. If one of the proposed initiatives outlined in lines 32 to 42 is mental health aftercare for gun violence survivors, the council that identifies and develops strategies for initiative implementation should have expertise in that area. This expert should be someone experienced in dealing with gun violence and its victims with an established background in youth outreach as well. I also believe that this mental health expert should not only act in the aftermath of gun violence, as the bill in its current state suggests, but should actively be involved in the outreach intervention programs and find ways to provide care and consultations to those who are at risk before gun violence occurs, not just to those who have suffered after the fact. I stand by HB 5397 and its provisions aiming to reduce the causes and effects of gun violence in Connecticut. I hope the committee will take my recommendations into consideration when working on this bill. And I thank you all for the opportunity to testify tonight. Thank you.
Thank you, Mr. Marzuk. Perfect timing. We do have 2 hands raised. Representative Parker, go right ahead.
Thank you, Madam Chair. Can you, Mr. Marzuk, can you just pronounce your first name again? Is it Stefan or Stefan? How did you say it? I'm sorry.
It's Stefan. Sorry, yeah.
Yeah, no, it's great. Thank you, Stefan, for being here. I just wanted to thank you for sticking around so late and being here with us and providing that context, sharing what happened at Coggins-Shog and now the work that you're doing at college. So thank you for joining us and sharing your opinions, and we look forward to taking that into consideration. Thank you, Madam Chair.
Thank you, Representative. And we also have Dr. Anwar. Go right ahead.
Thank you so much, Madam Chair. Stefan, thank you much for sticking around with us. And I know you had some special important studies that you had to do and you were back and forth. And I know it was very difficult. Your commitment and making sure that you get the word out of what we need to do is very important. So I appreciate you staying so late and hope you do well with your test that's coming up. Thank you.
Thank you very much, Senator.
Thank you, Senator. Thank you, Mr. Marzuk. Have a great rest of your night.
Thank you, you too.
Thanks. Next, we'll hear from 151, Deacon Arthur Miller.
Well, good morning and thank you, Chairman Gilchrist and all of the just distinguished guests, particularly my dear friend and brother, Senator Anwar. Thank you so much for your sticking around all day. I got to go and have dinner and turn you off, but you had to sit there all day, and I just absolutely want you to know I appreciate it. I'm from Windsor, Connecticut. I am a board member of CAGV and a board member of several other organizations, including not on Mothers Against Gun Violence, but a very good friend of theirs, of Henry Brown, and have worked with him. I'm a board member of Compass Peace Builders, board member of Connecticut Center for Nonviolence, and also a very close friend and supporter of Aran Nazario of the Peace Center, and Andrew Woods of the Hartford Community That Care. I have worked for peace and nonviolence in this country since my schoolmate Emmett Till was killed in Money, Mississippi in 1955. It is so profoundly encouraging that bills have been put forward in this committee and others that include provisions to address the crisis of community gun violence in Connecticut. House Bill 5307 and House Bill 477, rather, and Senate Bill 477 and Senate Bill 16, each are worthy of your consideration. I'm testifying in favor of the language of House Bill 5397, an act declaring gun violence a public health crisis and establishing the Office of Gun Violence Prevention because it incorporates 5 important components that should be present in whatever bill is voted out of your committee. It declares gun violence a public health crisis. It houses the solution in the Department of Public Health, where it can have the greatest impact. It has mechanisms to include the vital voices of those voices that have not been heard and who are most impacted by community gun violence. It includes a robust data gathering and research capacity to drive evidence-informed grant making. It calls for a funding commensurate with the magnitude of the crisis. And all one must do to recognize the vulgar randomness of unchecked gun violence that roams our streets is to read about the 62-year-old Hartford grandmother, Cynthia Reynolds, who was struck down while tending to her garden and the newly emerging buds that would bloom into spring flowers. The twin demons of violence and death claimed another sacred and innocent life. And this just can't go on. It must not continue. As the philosopher Edmund Burke declared, all it takes for evil to prevail is for good people to do nothing. We must respond to these violent acts by being good people who do something. I'm Deacon Art Miller from Windsor, Connecticut, and I'm also the senior deacon at St. Mary's Catholic Church in Simsbury, Connecticut. Thank you for listening.
Thank you, Deacon Miller, for being here and for dedicating your life to nonviolence. Senator Anwar, go right ahead.
Thank you so much, Madam Chair. Art, it's great to see you. I saw your name and I said, I'm going to wake as long as it's going to be. It's 2 a.m., 3 a.m. I love to hear your voice and love to hear your message. For the committee members, Art is not only a peace activist in Connecticut, but is known entire country and the world. Wherever there's a problem, Art finds a way to be able to do good there, and that's how he does. And Art, I think your message about our involvement as a committee, as the committees or commissions or the groups that we are forming, anything that you think that should be different in those? We do not have faith groups in there.
Yeah, I would hope that members of the community who are desperately impacted, poor people, have an opportunity to, if not be advisors, be the ones who will help make these kinds of laws and implement them. My friend, I walk up and down the streets every day. I hold crack babies. I've been through this. I've held women whose children have been killed and husbands whose wives have been hurt. Their voices, it's easy for me to come and to speak and to do and to speak for those who are quiet. I wish every single one of you would come into the streets and just walk and be and breathe in those places where it's difficult to breathe, to see and hold the hands of every single one of those who are suffering from all of the pain and the violence and the poverty, to breathe their air. It's an old saying that, I'm a clergy, that in order to really know how to tend your sheep, you got to smell like a sheep. And if you don't smell like a sheep, you don't know what the sheep is doing. And I'm just being real with you. You need to be with the people that are hurting. Now, I know Saud comes with me a lot of the places I go. And I've heard that Senator Moore does. I don't know, because I don't know you. But I trust some of the people who tell me that. So that's just the message. It's if you can't smell like the sheep you leading, then the sheep are going in another direction.
Wow. Very profound. And Art, in case you didn't know, I just love you.
Oh, my brother, you know, I absolutely adore you, my brother. And I know that every single one of you loves this state. We need to start acting like it. I'm gonna pray for all y'all.
Needed. Thank you. Thank you, Madam Chair.
Thank you, Senator. Thank you, Deacon Miller, for being here.
You're welcome. Am I last?
Well, I'm going to give one person one more try. 133, Christine Castles, are you out there? You need to accept the whatever it's called, the invite. If not, then yes, Deacon, you are the last.
Well, you all waited for the best to be last.
Yes, we did.
You know, I need to tell y'all, I am so impressed. I'm from Chicago originally, and to be able to speak to any of your representatives is a rarity. For me to be able to sit here and to tell my family, look, you know, y'all got to understand, I spoke to all of these representatives, and they're just not going to believe me. But, you know, I'm real. And I don't hold any kinds of fakery or anything like that. I want you to know that the people that were here today are honestly speaking their truths. Now, whether I agree with them or not, they took the time to speak their truths. And I think we are a better place for it. I'm a veteran not only of the civil rights movement, having gone to jail when I was 17 back in 1963, but I'm also a Vietnam era veteran. Because you see, I love this country. And I've seen a lot in my life, from my friend Emmett Till to today. I hope with all my heart that every single one of you considers truly what's best for this state of ours. Hope, I hold this profound hope that we can be what we're supposed to be and lead this nation in preventing violence. And I will ask God to bless every single one of you, to give you guidance in your thoughts. And may you all very well sleep very well tonight. God bless you and amen.
Thank you, Deacon Miller. With that, I'm going to turn it over to Representative Chairman Steinberg.
Well, that's all, folks. We've certainly begun at it this session. I want to thank everybody for hanging in today. Some excellent questions, some very interesting interchanges, and most importantly, some testimony that I think gives us much more insight than we certainly would have had when we came in today. I have tremendous admiration for everybody on this committee, but I feel if I say any more words, I am depriving everybody of what sleep they may yet have. So see you on Wednesday when we have our maybe final JF meeting. We'll see. And thank you all.